Is your skin whispering warnings you've ignored? When we think of health warnings, we often imagine sharp pain, high fevers, or alarming test results. But what if your body's first cry for help is actually a whisper? For many older adults, the body stops speaking in dramatic symptoms. Instead, it begins to communicate quietly through subtle, recurring sensations. One of the most underestimated of these is itchiness. Not the kind you get from a mosquito bite or dry winter air. We're talking about those strange, nagging itches that seem to appear out of nowhere and stay. Dr. Harold Bennett, now 85 and still seeing patients part-time, has a favorite saying: "The body never lies. It just gets quieter with age." He warns that many of his older patients brush off persistent itching as just part of getting older. But skin, especially in seniors, can act like an early warning system, giving us clues about what's happening beneath the surface. Think of your skin as your largest organ. It's not just a protective shell, it's a messenger. And every itch has a potential message attached to it. Your liver is struggling. Your circulation is slowing down. A nerve is misfiring. Something dangerous may be growing beneath this mole. And yet, most people never ask why they're itching. They just apply another cream and move on. That's why this video matters. It's not meant to alarm you, but to awaken you. To encourage you to listen to the signs you may have ignored for weeks, months, or even years. Sometimes the body doesn't send an ambulance. It just sends an itch. And if you've been scratching the same spot again and again, it may be time to ask, what are you trying to tell me? Because aging wisely doesn't mean fearing every symptom, it means understanding them. You don't need to panic. You just need to pay attention. And that journey begins with a simple but powerful question. Is your skin trying to tell you something that you've been too busy, too polite, or too tired to hear? Now, let's break down what those 6 itchy areas might really mean. And why, after 60, they could be your body's early warning system you can't afford to ignore. 1. Itchy lower legs, a sign your circulation is struggling. The lower legs may not seem like a danger zone, but in older adults, they often become the canary in the coal mine for poor circulation and deeper metabolic issues. When Dr. Bennett examines a patient with chronically itchy shins or calves, he doesn't reach for a lotion first. He reaches for a stethoscope and asks, "Have you noticed any swelling? Do your feet feel cold at night? Do you get cramps when you walk?" Because behind that persistent itching could be peripheral artery disease, PAD, a silent, progressive condition where the arteries that carry blood to your legs become narrowed or blocked due to plaque buildup. Poor blood flow leads to dry, flaky skin, but it doesn't stop there. It also slows down wound healing, increases the risk of infection, and may even lead to tissue damage or amputation if left untreated. Dr. Bennett shares another case. A 74-year-old woman named Barbara came in with cracked, itchy skin on her ankles and calves. She had scratched them so much in her sleep that they bled. She assumed it was eczema. But Dr. Bennett noticed faint pulses in her feet and cold toes, classic signs of PD. A vascular ultrasound confirmed it. Barbara was treated early, and today she walks daily with stronger legs and healthier skin. But if she'd only treated the itch with creams, the underlying disease would have progressed quietly, potentially leading to a serious event like a stroke. Another hidden cause? Diabetic neuropathy. In diabetics, especially undiagnosed ones, the nerves in the lower legs and feet can become damaged. This often begins as tingling, burning, or itching, well before pain sets in. If your legs are itchy and feel numb, tingly, or extra sensitive, especially at night, your nerves may be trying to warn you. And let's not forget venous insufficiency, where the valves in your veins weaken and blood pools in the lower legs. This causes fluid retention, swelling, and skin that itches intensely, often around the ankles. In some cases, it leads to ulcers. So what should you look out for? Itchiness that doesn't improve with moisturizers. Discoloration or shininess of the lower legs. Swelling or throbbing, especially at the end of the day. Tingling or numbness in the feet. Thin or patchy leg hair. Skin that breaks open or bleeds easily from scratching. If you experience these, don't write it off as dry winter skin or poor soap. Ask your doctor to check your blood flow, blood sugar, and nerve function. Your legs carry you through life. And sometimes they itch, not because they're dry, but because they're desperate for help. 2. Itchy scalp could be more than just dry skin. For many people over 60, an itchy scalp is one of the most frustrating daily discomforts, yet it's also one of the most misunderstood. We assume it's just dryness, product buildup, or the weather. But for seniors, the scalp often reflects deeper hormonal, neurological, or even systemic imbalances. As we age, our bodies naturally produce less sebum, the oil that keeps our scalp moisturized. For postmenopausal women and older men, this decline can lead to dryness, sensitivity, and an itchy, tight-feeling scalp. But here's where it gets tricky. Itching doesn't always mean dry skin. Sometimes, it signals inflammation, hormonal shifts, or even the nervous system misfiring. Dr. Bennett shares the story of Harold, age 66, who had persistent scalp itching that wouldn't respond to any treatment, not even medicated shampoos. It was dismissed as just age. But after a thorough evaluation, a neurologist uncovered early-stage Parkinson's disease, a condition that can disrupt sensory processing and cause abnormal skin sensations, especially on the scalp. In other patients, Dr. Bennett has seen scalp itching tied to seborrheic dermatitis, a chronic inflammatory condition that causes red, oily, and flaky patches. Psoriasis, which can cause thick, silvery plaques on the scalp and nape of the neck. Contact dermatitis, often triggered by hair dyes, harsh shampoos, or allergens. Tinea capitis, scalp ringworm, a fungal infection that's more common than people realize, especially in immunocompromised seniors. One of the most overlooked factors in older adults? Stress and anxiety. The scalp contains a high concentration of nerve endings. Chronic stress can heighten skin sensitivity and cause a psychogenic itch, a real sensation with no visible cause, driven by internal tension. So how do you know when scalp itch deserves more attention? Backhand index pointing right if it's chronic, lasting more than 2 weeks. Backhand index pointing right if it comes with visible redness, scaling, or hair thinning. Backhand index pointing right if it worsens at night or after emotional stress. Backhand index pointing right or if it doesn't improve with simple changes like switching shampoo. Then it's time to go beyond the drugstore. A dermatologist, or in some cases, a neurologist, can help determine the root cause. Because an itchy scalp isn't just annoying. It might be your nervous system, your immune system, or your hormones trying to get your attention. Don't just scratch and dismiss it. Scratch and ask why. 3. Itchy eyelids, a delicate clue to deeper problems. Your eyelids are small, but mighty. They're made of the thinnest skin on your body, rich in nerve endings and blood vessels. And because of their delicate nature, even the slightest irritation there can feel magnified. But when eyelid itch becomes chronic, recurring, or is paired with swelling or redness, it may be your body waving a red flag. One of the most common culprits in seniors? Blepharitis, a chronic inflammation of the eyelid margins caused by clogged oil glands and bacterial overgrowth. It causes itching, flaking, and a gritty feeling in the eyes. Often confused with simple dryness, it can lead to long-term discomfort and blurred vision if untreated. But the list doesn't stop there. Dr. Bennett urges his older patients not to assume eyelid itching is just allergies. Because in his experience, this subtle symptom sometimes reveals much more. Let's break down the lesser-known causes. Autoimmune disorders. Conditions like lupus and Sjogren's syndrome can attack moisture-producing glands, causing dry, itchy, inflamed eyelids, often mistaken for seasonal allergies. Thyroid dysfunction. Hyperthyroidism or Hashimoto's thyroiditis can lead to thyroid eye disease, which often begins with itchy, dry eyelids. Other clues include puffy eyes, bulging, or sensitivity to light. Eczema or contact dermatitis, triggered by skincare products, facial wipes, or eye makeup, even brands labeled sensitive. In seniors, skin becomes thinner and more reactive, increasing the likelihood of allergic reactions. Ocular rosacea, often overlooked. This skin condition can affect the eyes, causing burning, itching, and redness of the eyelids and conjunctiva. It's frequently misdiagnosed as eye strain. Dr. Bennett remembers Sarah, 70, who came in complaining of itchy eyelids that were worse at night. She thought it was her mascara. But after thorough testing, she was diagnosed with low thyroid hormone and early signs of Graves' disease, a condition she never would have caught early if she hadn't mentioned her eyelids. So how do you know when to take eyelid itch seriously? If it's persistent and doesn't go away after eliminating irritants. If it's associated with fatigue, dry mouth, or light sensitivity. If there's swelling, vision changes, or the whites of your eyes look red. If you have a history of autoimmune conditions or hormonal imbalances. Don't assume your eyes are just getting old. Sometimes they're the first part of the body to signal something's off, long before you feel sick. Your eyelids may seem small, but they have something to say. Make sure you're listening. For itchy upper back or shoulders, especially if you can't see it, the upper back and shoulder blades are often the most neglected parts of our body, not because they're unimportant, but because we can't see or easily reach them. And that's exactly why they become dangerous hiding spots for early signs of serious conditions like skin cancer. Dr. Bennett says this plainly. When you're over 60, any chronic itch you can't see needs to be taken seriously. For many seniors, back itchiness is written off as dry skin, laundry detergent irritation, or just age. But over 5 decades of clinical experience have taught Dr. Bennett that melanoma, basal cell carcinoma, and squamous cell carcinoma often start with an itch, before there's ever a visible sore or mole. These itches can be mild or intermittent, which is why people ignore them. But they persist. And they may be your body trying to say, something's growing here, and it's not supposed to be. Dr. Bennett recalls one patient, Arthur, 78, whose wife noticed he was scratching his right shoulder every night before bed. It looked like a dry patch. She insisted on a skin check. The result? Stage 0 melanoma, completely treatable because it was caught early. Arthur is still alive today because of an itch he almost ignored. Other potential causes of upper back itching in seniors include notalgia paresthetica, a nerve-related condition that causes chronic itching or burning on one side of the upper back, often without visible rash. It results from compression of spinal nerves, common in older adults with spinal degeneration. Fungal infections, especially common in warm climates or people with compromised immune systems. Drug reactions, some medications, including blood pressure or cholesterol drugs, can cause local skin hypersensitivity or itching. If you notice a mole or bump that itches or bleeds, itching that doesn't improve with moisturizer, a scaly patch that feels different than the surrounding skin, or an itch in the same spot, again and again. Don't rely on mirrors alone. Ask a spouse, child, or friend to check your back periodically. Take photos of any spots to track changes. And remember, itchy doesn't always mean innocent. Especially if it's in a place you can't see. When your skin speaks from behind you, it's often the whisper you need to hear most. 6. Itching, down there, embarrassing but never irrelevant. Let's face it, this is the part no one wants to talk about. But Dr. Bennett is clear. Just because something is embarrassing doesn't mean it's unimportant. In fact, it's usually the opposite. Genital or rectal itching is incredibly common after 60 and often goes ignored or self-treated in silence. Because older adults are often conditioned to feel shame or discomfort when discussing intimate symptoms. But here's the truth. Ignoring an itch down there can mean overlooking a serious medical condition that's entirely treatable, if caught early. Let's look at what could really be behind that private discomfort. Fungal or yeast infections. Due to age-related changes, seniors are more prone to skin breakdown and moisture buildup in warm areas. Wearing incontinence pads, tight undergarments, or synthetic fabrics can trap moisture and lead to candida overgrowth, causing itching, burning, and rash in the genital or perianal areas. B. Diabetes. High blood sugar levels fuel yeast and bacterial infections. For both men and women, persistent itching, especially with no visible rash, can be the first external sign of undiagnosed or poorly managed diabetes. C. Lichen sclerosis. A little-known but serious skin condition that causes thin, white, itchy patches around the vulva or anus. Dr. Bennett notes that this condition is more common in postmenopausal women, and if left untreated, can lead to pain, scarring, and increased cancer risk. D. Hemorrhoids or anal fissures. Rectal itching is frequently due to swollen veins or small tears, particularly in those with chronic constipation, low fiber intake, or sedentary lifestyles. The discomfort is often worse at night or after bowel movements. Skin cancer. Yes, even the genital region can develop squamous cell carcinoma, often presenting as an itchy, scaly, or bleeding patch. Because it's hidden, it's often diagnosed later than it should be. So what should raise a red flag? Persistent itching lasting more than 1 to 2 weeks. Itching that wakes you up at night, accompanied by burning, skin changes, or bleeding. No relief from over-the-counter creams. History of autoimmune disorders, diabetes, or past skin conditions. Dr. Bennett urges, if something's not right down there, don't suffer in silence. That itch could be your lifeline. Genital health is a part of total health. It's not awkward. It's not taboo. It's human. And in your 60s, 70s, and beyond, it deserves your full attention, compassion, and care. Final reflection, every itch has a message. In our younger years, the body speaks loudly. A sprained ankle swells. A fever burns. A wound bleeds. But as we grow older, the body gets quieter. The messages are still there. They're just whispered instead of shouted. And sometimes, the whisper comes in the form of a simple, persistent itch. An itch may seem trivial, annoying, something to dismiss with a scratch and a shrug. But Dr. Bennett teaches us to pause and ask, what if this itch is not the enemy, but a messenger? When your skin tingles in the same spot day after day, when your hands won't stop itching at night, when your back itches in a place you can't even see, those aren't random events. They may be early signs of something deeper. And here's the real gift in all this. It means your body still cares enough to warn you. It hasn't gone silent. It hasn't given up. It's trying to help you in the only way it still can. Too many people brush aside symptoms, telling themselves, it's just aging. But aging doesn't mean ignoring your body. It means knowing it more intimately than ever before. So let this be your takeaway. The next time you reach to scratch, pause for a moment. Don't just ask where it itches. What? Because in that moment of curiosity, you could catch something early. A liver imbalance. A circulation problem. Even the beginning of cancer. And you'll have given yourself the best gift of all. Awareness. And a chance to act early. So which message is your skin sending you today? And are you willing to listen? If this video helped you feel more informed and empowered, please click like, subscribe, and share it with someone you care about. Because every body tells a story. And your story matters, especially now.